Good evening, good afternoon, and good morning. This is the 1852nd day of continuous daily webinar conducted by International Forum for Promoting Homeopathy. IFPH comprises of homeopathic students, lovers, and doctors. Let's begin the session with a silent prayer. Thank you, everyone. So just a quick reminder that we are celebrating our 5th anniversary on 28th September at Kerala, Cochin at Taj Vivanta. So now I want to proudly welcome our today's guest, Dr. BAINU SHARMA. Sir has joined? Yes, sir.
Yes,
Yes.
Madam is there.
Madam is there. Okay, sorry. I'm extremely sorry for that. So I proudly welcome Dr. BAINU SHARMA. She is currently working in JIMS Homeopathic Medical College and Hospital, Hyderabad, as a professor in the Department of Materia Medica. Ma'am is adorned with the title of MD in Homeopathy. She is having more than 22 years of clinical experience. And for today's session, her topic is healing beyond surface. Case reports in homeopathy. So, with this interesting title, I like to invite Madam to begin her session. We are eagerly waiting for her experience and knowledge so that we all can get benefited from this. Ma'am, over to you. Please begin your session.
Thank you, Dr. Shruti. Good evening, everybody. Am I audible, Dr. Shruti?
Yes, ma'am.
Okay. So, good evening, everybody. This platform is not new to me. I have already given, I think, 6 sessions. This is my 7th session in IFPH, and I'm really glad and I'm thankful to MK Sani sir and Dr. Dhanish for inviting me yet again for this session today. And already we are 4 minutes late. So without any further ado, thank you, Dr. Shruti, for such an effusive introduction of mine. And I'll start sharing my screen. Good evening, everyone. So first of all, let us start the session by thanking our master, our founder, Dr. Christian Frederick Hahnemann sir, who gave such a beautiful means of healing humanity of homeopathy. Then I would really like to thank my organization, JIMS Homeopathic Medical College and Hospital, from where I can work and I can give results with the help of this amazing pathy. And out of one of my cases, because I really got very short time, surprisingly, 2 days back only I spoke with Dhanish sir, and he said, if you are interested, we'll keep a session. So only one case report I could prepare, but relating to that case report, we'll discuss few rubrics which will be with respect to the case itself. Okay, so today's topic is healing beyond the surface. It's a case of a generalized pustular psoriasis, which we treated with the help of LM potency. So with the help of today's presentation, what all things will we take home? What are the learning objectives of this 1 hour of session today? Is that young minds, budding homeopaths who are listening to this session, they will learn how to prepare a case report in homeopathy. Because this case report, which I am presenting today, is totally based on the total home case criteria, keeping in mind the scales, keeping in mind the monarch. So it will help people who are interested to prepare, case reports or paper presentations, giving their case reports for publications. That is one objective today from this session. Another objective is systemic integration. See, I belong to an institution where the name itself says GR Integrative Medical Services. So we integrate. Today, my purpose also by telling you this case report is how to integrate the organon with homeopathic materia medica and homeopathic repertory. Only with the help of this one case, you will realize that whatever principles of homeopathy are laid in the organon of medicine and homeopathic philosophy, how beautifully we utilize that and we prescribe medicines. Then we will come to know about the scope of homeopathy in any kind of a difficult skin condition. We will also learn about the effectiveness of LM potencies in severe critical conditions. And in the end, if time permits, we will discuss about some rubrics about grief. So this is the purpose of today's presentation. I hope we take home these learnings after the session is over. Before presenting my case, let us just, for people who are not belonging to the medical fraternity, let us just learn what psoriasis is. Psoriasis is a chronic proliferative inflammatory condition of the skin. It's something looks like this, where there are all silvery scales throughout the body. It is, and my case today specifically is of generalized pustular psoriasis, which is a type of psoriasis vulgaris, which is a very rare immune-mediated systemic disorder characterized by yellowish kind of pustules, red base with a wide range of clinical presentations and distribution patterns. I have gone through many cases of psoriasis in various journals, but I did not get any article on generalized pustular psoriasis. So instead of presenting multiple cases today in 5 to 10 minutes gap, I thought I'll extensively discuss this case so that we just learn something about the full case report. So let us come to the case now. Let us stick to the information given by the patient. A 35 years old male patient, 9th class pass out, visits our hospital on 9th of Feb 2025 with these following complaints. Very offensive smelling pustular eruptions all over the body, excessive scaling of the skin, along with itching, body pains, which the patient felt like burning and aching type. On the observation at the site of the pustules, on the scalp, on the hair follicles, there were no hair. The nails of both the fingers as well as of the toes were unhealthy. And the patient was in a very miserable, very hopeless, and very sad mindset because of this condition of his. When he entered the OPD, he was smelling very offensively. He was not able to walk. Pus was oozing out of his pustules. Scales were shedding from his psoriatic lesions. He was in a very, very bad state. This was the picture of the patient. You can have a closer look. Not even one single part of this man's body was spared from this skin disease. Shall I change? Is it okay?
Yes, ma'am, you can change.
This is his condition. Please have a closer look because we will have now and then photos, and then you can appreciate the beauty of homeopathy. Let us go to the history of the presenting complaints. The patient was suffering from this complaint since 2017, and he was on allopathic medication for 6 months. He discontinued allopathic medication because he was only getting relieved temporarily. Then after insistence from his family, this patient consulted some homeopath. He was relieved, but after stopping the medicine, the complaints were reappearing. So he sought medical help, allopathic as well as homeopathic, before he came to us. His condition became very, very miserable and was confined within the house because of the severity of his skin state. Not only skin, he had full body ache also. The existing skin condition and the whole body pain restrained our patient from going out to work. In the family history, there was nothing specific about the mother. He has one sister who was married and mother. His father died early because of a sudden heart attack. That is what we got in the family history of the patient. So my request to everybody who is listening to the case, I would want you to start observing the photos and start repertorizing, start analyzing the case so that we work on that case and let us see that if we come to a conclusion of a similar remedy. So it will be kind of a task for you, an exercise for you. So those interested, if you are students or if you are keen to learn, even if you are physicians, you can please start repertorizing the case. I'll narrate the case to you. In physical journals, there was nothing much specific. He had a regular appetite along with a normal thirst, nothing very specific about the thirst. Bowel movements were regular, soft stools once a day. There was nothing very abnormal about the urine. Urine was okay, 7 to 8 times in a day. Perspiration mainly on the forehead, that too only after exposure to sun. Otherwise, perspiration was scanty. He slept around 7 hours a day, felt refreshed in the morning. Dreams were generally related to work or business. On and off, very occasionally, he said that he used to consume alcohol and tobacco. The first day when the patient came to us, he was in a very bad state. The thermal status of the patient was chilly. So he was not in a state to even answer. He came in the OPD with his sister and brother-in-law. So the whole case was being narrated by the sister. But when he came first time to the clinic, as I told you, he was smelling very offensive. He was not in a state to sit on even on that examination stool. So only looking at the patient, like he was having a desquamation, he was having pustules, there was too much of offensiveness, there was burning, without going into too much detail, considering the state of the patient. The sister was very, very anxious. Me, with few of my PGs who sit with me, we prescribed arsenicum album to the patient. And because he was in a very bad skin condition, we had no scope of flaring up the disease or no scope of aggravations. So we started with the LM potency and we gave him arsenic 0/1, TDS for a week. So on, I think, 9th of Feb, he came to us. We called him after a week. He came to us after a week. But before that, I'll tell you the full recipe in very short way. Before telling you the life space investigation, I would like to emphasize on the fact that when we physicians are presenting our cases to you on screen, it is the most filtered and almost already prepared dish. But when we take a case, it takes too much of hard work, too much of teamwork efforts to present you a crisp case so that when you read the symptoms or a life investigation, you feel, oh, it is a very, very simple thing. How we can just prescribe. But when we conclude these points which we put in front of you, there are lots and lots of filtering, lots and lots of analysis and evaluation. Metaphorically, if we understand this, when a mother prepares dishes for us, say any dessert, she'll take hours and hours in the kitchen. And when it takes only 5 minutes for us to have that food. It's just the same way we physicians, we work hard to present one case report to you. So to present these symptoms, it really took lots and lots of effort to us to reach to a simillimum. So having that in mind, just go through the life space investigation. Think about the drugs. If you want, you can write the drugs in the chat box. I would really appreciate your effort for that. This patient was born and brought up in Telangana. He discontinued the school. I told you he's a 9th pass because he was not very much interested in studies. And before going further, I would really like to thank our patient also, because before presenting his case, we priorly sought his permission. So he agreed, and I'm really very grateful to him. The complaint started after the sudden death of his father. He could not accept his father's untimely death. He developed anxiety, worries about how the family will be carried forward, what will be the future, how will we develop a financial security of my family. So he thought that it's better for me to start working. Then he started taking care of things in the family. He is the only son. He has one sister, only two kids. Father was the one who was the earning member, and he died early, leaving these two kids. But the daughter was, I think, single that time. He is one man who never liked to stay idle. But because of this, after a month or so of his father's untimely demise, this patient started developing psoriasis. He said, I never liked to sit idle, but because of the severity of my skin condition, even if I wanted to, I could not go out. I showed you the images. You can make it out yourselves. Patient told that because of his miserable state, he could not go out. What will people think about my condition? So I was not in a state to go out and work. Whenever, people like mother or sister scolded him for taking tobacco or abusing alcohol, he used to become violent, and anyone contradicting him, he used to behave violently. This is what his sister told us. Whenever he gets angry, he tries to break things, try to throw things around. This also the sister told us. And the patient said that he never really wants to share his emotions and feelings with people. He held the emotions within. He said, I am not a very open person, and I keep the feelings. I don't express my feelings at all. And he lacked confidence when appearing in public. He's not a very confident person. So the mental symptoms, I don't know if you want, you can share the mental symptoms in the chat box. I would love to see that. Can you tell me which all mental symptoms I considered? I can read that in the chat box if you want to. Or if you want to put on your speakers, Dr. Jyoti, Dr. Shruti, if anybody wants, we can ask them. Nobody. Everybody is in a dinner mode. So the mental symptoms which we considered as of importance is that all the complaints started after the death of his father. This is what I was telling you initially when I told you what are the learning objectives of the day. When we integrate homeopathic subjects, if we keep in mind the principles, the cause and effect relationship, if we get that in a case, we keep that at the topmost priority. The cause, that is the thing which causes, and the effect, that is the symptomatology that comes to us. The cause and effect relationship defines the individuality of a patient. So it helps us to reach to a simillimum, right? So here we considered the cause of this patient as death of his father, and the effect was psoriasis. I wish if this would have been a face-to-face interaction, it would have been a nice interactive session, but because it's online, so it's a
Ma'am,
monologue.
some comments are there in chat box.
Okay, let us.
Yes, ma'am. Dr. Subhas has written the rubric maybe shame or grief, and Dr. Susmita has written suppression of emotions. Then Dr. Ram Pravesh written anxiety. Dr. Mahesh has written elements from grief, elements from death of loved ones.
Very good. Not bad at all. This is very good, all of you. I'm really very, very happy that there is such platform where homeopaths think alike. You are on a right track, and that is the beauty of good case taking, I feel. So let us come to the next rubric, mental rubric, which we considered. He grieved about his diseased state. He was very much concerned about he himself into that diseased condition. I am in such a bad state. I cannot go and work. My father is no more. My mother is there. I'm dependent on my mother. How will the finance run? How will we survive? How will my future be? Not still married. I can't go for work. I don't have a job now. Because of this condition, I just quit my job. So he was choked with emotions while narrating all this to us. Now, what arsenic did to us, I told you that we gave him arsenic initially. What arsenic did helped us was that in the first follow-up, when he came to us after giving him arsenic in LM potency, this patient was 90% better. Then we thought that the patient, at least arsenic helped him to stick to us. Arsenic helped him to gain confidence in us. Us means homeopathy. So he came. Exactly after a week, he came. Initially, for many weeks, we called him after every week, even though this patient stays quite far from our hospital. And it was very difficult for him to come. So after 2-3 follow-ups, we were just, his sister and brother-in-law used to come to take medicines because LM potency is not available everywhere. And we used to talk to the patient on video call because he was in a bad state. And there was chances of infection, so we didn't take a chance. And we thought convenience of patient is most important. His comfort level is important. So we said, you don't come, we'll utilize the technology and we'll take a phone call. Then that was one good thing which happened after giving arsenicum album, even though arsenicum album was not his constitutional drug. Then this patient has a tendency to break and throw things in anger. He looked like a workaholic person to us who was too much, thinking about or worrying about his job, his work. He was very much concerned about that, worried about that. He kept his feelings and his emotions up to himself. He never expressed his emotions. He kind of suppressed his emotions. And he was not a public person. He lacked confidence when it comes to appearing in public. General examination, ectomorphic built. Then he was a poorly nourished man. BP was okay. Weight was 51 kgs. Conjunctiva, we saw a little pallor. And nails, as I told you, were unhealthy, dry, thick, and the growths of the nails was arrested. Local examination, skin being the main sphere. The eruptions were pustular, distributed all over the body, abdomen, face, eyelids, extremities that I showed you in the image before. Character of lesion, irregularly sized eruption with scaling and crusting. Extremely, extremely offensive discharge. Silvery scaly eruptions. Dry scales in nature. And Auspitz sign, which is a diagnostic criteria for psoriasis, was positive. Diagnostic assessment. The case was diagnosed clinically as generalized pustular psoriasis. According to ICD, it comes under specific code EA 90.40. Skin biopsy is usually unnecessary when we have a classical manner. So Auspitz sign was positive. The analysis and evaluation. So we divide it into general symptoms, characteristic particular symptoms, and common symptoms. In general symptoms, first we considered the mental symptoms, then we considered the physical symptoms. In the mental symptoms, the eruptions from suppressed grief, ailments from death of loved ones, anger contradiction from, break things in anger, and industrious. And physically, thermally, the patient was chilly. I think most of you have already pointed out these mental symptoms. That is very good to know. And characteristic particular symptoms, eruptions were extremely, extremely offensive. It was better, but these were the reasons we initially gave him arsenicum album. And it was better by abortion, destroying the hair follicles. Common symptoms which were common to the disease, we didn't consider scaly eruptions, itchy eruptions, pustular eruptions, burning and pain on scratching. So we considered them as common symptoms. By now, everybody know what is the core of the case. If you can mention in the chat box and Dr. Shruti can tell me, read out if somebody tells rightly what is the core of this case. Dr. Shruti, I'm waiting for the reply. Shall I proceed?
Ma'am, in the chat box, Dr. Mahesh has written death of loved ones and anxiety. Dr. Divya has written grief. And Dr. Ram Pravesh Shah has suggested medicine Astromute.
Okay, the core of case, I think Dr. Divya said though, she's bang on right. The core of the case was grief. The death of the loved one was the cause of grief. So basically the core was grief. Dr. Mahesh, this is the answer for you. So the totality was totally constructed following the repertorial method. I heard just for 5 minutes, I heard M.K. Sahani sir saying about the importance of repertorizing a case. So yes, sir, we utilized the repertorial method, and the selection of the medicine is based on the totality, which was built by the help of repertorial method. And I use radar for that. This was the repertorial sheet, and these are the symptoms where we did miasmatic cleavage also, which mainly came out to be syphilitic. Skin, eruptions, psoriasis, grief, or suppressed emotions after. Ailments, death of loved ones, parents, or friends of. Mind, grief, condition about his. Skin, eruptions, desquamating. Skin, eruptions, discharging offensive. Mind, industrious. Mind, anger contradiction from. Mind, breaking things. Extremities, nails, complaints of growth of nails arrested. Skin eruptions, discharging, destroying. Hair. So let me go back to the repertorial sheet now. And 10 rubrics we considered. Out of the 10, all the 10 rubrics were covered by this one wonderful, wonderful homeopathic remedy, Staphysagrega. So out of the 10 rubrics selected for the repertorial totality, this is the scoring. Staphysagrega, 10 out of 10. Arsenicum, which came the next, but which we gave him initially, was 5 out of 10. Ignatia, Lycopodium, Medorinum, Merck, Natramur, Dr. Ram Prasad sir said, then Nux vomica, sulfur, veratrum album all scored 4 out of 10. So the final remedy which we selected after arsenicum album, even though his skin complaints were getting better, but the patient was not getting better, we gave him Staphysagrega, and this is the follow-up summary. Baseline visit was on 7th of Feb. Offensive pustular eruptions, we gave arsenicum album 0/1 for a week. He came on 15th. Offensiveness was improved. Discharges were improved after arsenic 0/1. Pain and burning all over the body was improved. All the generals were improved. So we gave him 0/2 again for 10 days. Then he came on 22nd of Feb. Oozing of discharges was improved. Offensiveness was better. Desquamation and scaling was present. Discharge from the eyes he had since last 3 days. So the case was taken and repertorized again as the baseline prescription failed to relieve the chief complaint. Here we gave him Staph 1M potency 1 powder dose, and we called him after a week. On 1st of March, the patient came. The complaints were better after taking previous medication. Burning was still persisting. Scaling of the skin improved by 40%. Drying of the skin improved by 40%. And the patient showed the eagerness to rejoin his job. He was constantly dwelling on the thought that I am sitting at home, I want to work, I want to work. So, keeping his improvement in mind, we went forward with staph 10M, one powder, and then we called him again after 10 days. He came on 8th of March. Severe dryness of the skin compared to the previous follower, excessive scaling of the skin, itching, wants to scratch, but he was not scratching. Burning in the eyes improved. Pustules are burning over the leaves improved. Toenails started showing growth. And in sleep, he talks about work. Now we started giving him LM potency now. We thought of giving a potency ahead. We gave him 0/3. As 10M potency already was administered, so we started with 0/3. TDS for 5 days and placebo for a week. On 15th March, the patient came to us again. Marked improvement, recurrence of generalized body pains once the medicine was finished. Staph 0/4, TDS for 10 days. And then he came to us on 22nd of March. All the complaints were better by 70%. Itching improved by 50%. Staph 0/5 for 10 days. So we kept on increasing the potency till we saw that the patient's skin was almost clear. Then on 28th of March, 80% improvement, complaints of sensation of fullness in the ears. Then patient joins his job. This was very, very important and very pleasing news for us that he said that I joined the job. Now I go to work daily, which showed to us that, this was not, that is why I gave this title to my presentation, Healing Beyond Surface. So he gained his confidence. He gained his almost life back. He was the bringer of bread and butter to his family. He started earning. Every time his mother and sister used to come for his follow-ups when he was on call, they used to cry very, very badly that, our son is in a hopeless situation. Here he started working by. We still continued with 0/6 potency. On 12th of April, again, he was in a better mode only. Everything was going on well. So we gave him 0/7. On 28th April, on the chest, he had slight eruptions, itching, everything was gone. Pain was there, slightly on touch. We gave him 0/8. And on 8th of May, then he came, scaly eruptions improved. We continued with 0/8. On 23rd May, when he came, now in the last few follow-ups, he was coming. Since he joined his job, he was the one who was coming to us, along with the sister. And lately, he's still late coming to us. But now he comes to us after, say, 30-35 days, just for a follow-up, because we know that psoriasis is one condition which might go into remission. So that is why I presented this case only after I have so many follow-ups of the case. And he had a marked improvement in the month of May. Normal looking skin, free of any pustules, free of scaling. I'll show you the images to just, give weightage to what I have written. He continues his job. We gave him placebo. He came on 12th of June, small eruptions which lasted only for 2 days. We continued with 0/8 because then we saw massive improvement. So I thought it's no need to increase the potency. Then 12th of June, then he came on 3rd of July. Eruptions were there. He said that disappeared after taking the medicine only. He also had the in-between tastelessness also, but then he said his taste is better, itching is better, nails are drying up, old nails are shedding, new nails, he said, are showing. So we kept him on 0/8 potency. On 8th of August, hair growth improved. There were no hair follicles, very less hair started falling, no eruptions, skin got cleared. Overall, the patient was feeling, and he was working since then. Overall, patient is feeling energetic, lively, continuing his job, thanks to our master, thanks to homeopathy, thanks to the beauty of homeopathy. We gave him 0/8, and we considered, as I told you, it is very important to present your cases in an authentic way. So we also took a generalized pustular psoriasis physician's global assessment scale to see the level of improvement. So we used this scale. It is a score which is adapted from the Physician Global Assessment, a tool which physicians use to assess the psoriatic lesions, to assess the severity. This is the scale. Pustule score, erythema score, scaling and crusting score. So the score before the treatment was 11. The score after the treatment was 2, which showed a very marked improvement in this particular case of generalized pustular psoriasis. You can have a look at this. Anything, Dr. Shruti, you want to tell me from the chat box? If people have if you have any queries, you can please ask me. Or we'll have an interactive session after I finish the case. We can do that. And Monarch criteria was also applied to this case. And the total scoring of Monarch also was 11, which showed a very, very good improvement in the case and a very good effective cause and effect relationship. This is the scale score. So finally, what we
Ma'am,
discussed.
one question is there in the chat box.
Yes, please tell me.
Dr. Mahesh asks how LM potency is dispensed to patient.
We dispense LM potency in rectified spirit and diluted.
Come there.
Only 2 globules of LM potency we dilute in either 30 or 100 ml and we give it to the patient, which he takes every lit depending on the frequency of repetition of the dose. Okay. Distilled water may we'll prepare that and we'll give it to the patient, 2 globules of LM potency. Okay. So this case of generalized pustular psoriasis was successfully treated using constitutional homeopathic medicine, Staphylococcus aureus. In this case, LM potency was selected considering very low susceptibility of this patient and considering the severity of the skin condition, as LM potency is noted for including lesser aggravation, allowing the patient to progress even with minimal improvement after a single dose of medicine. So here we are seeing the integration of the materia medica, repertory, and organon. That was one learning outcome. Grief being the core of the patient, the presenting complaint covering the same as a single remedy rubric. We chose highest of the potencies, then LM potency in increasing order till the patient showed complete relief from the chief complaint. Staphylococcus aureus is the single remedy under the rubric psoriasis after grief or psoriasis after suppressed emotion. It is one of the most importantly indicated remedies with causations from death of parents or from grief or suppressed emotions. I hope everybody knows that. But it is a single, surprisingly, even though we got, in all the 10 rubrics were being covered by Staphylococcus aureus, but there was one rubric in that which was a single remedy rubric, which gives so much of weightage to us and which helps us to have confidence that it was a simillimum for the patient. So if you go to the chapter of skin in the repertory and you go to eruptions psoriasis, there in the sub-rubric you will see grief from single remedy is Staphylococcus aureus. So that is one learning which you can take today. This case illustrates the effectiveness of individualized homeopathic approach along with the efficacy of LM potency in severe skin conditions. This case report is following full home case guidelines for reporting the positive outcomes. And as I told you, cause and effect is about the understanding that why a disease occurs, what is the exciting, fundamental or maintaining causes, and how it expresses itself in the form of symptoms. And we use this relationship to individualize the remedies through studying ailments from the rubrics by forming the totality. We have so many factors like, ailments from this causing that. So, for example, ironing leading to suppressed menses, ironing leading to headaches. So the only drug where we'll see that the person is having headache or suppressed menses because of ironing clothes, you can put it in the chat box. The only drug in your materia medica is bryonia. So there are many suppressed menses because of so many things. Even grief will cause suppressed menses, but the drug is different. So that individualizes and helps you to reach a minimum. So we should give importance to the cause and effect relationship. Now let us come to the final show of the case, for which I think most of you will be waiting. These images I showed you in the starting, just to, tell you the severity of this patient. So the next is in March. Just have a look at the dryness of the scales. Not even single part of his body is left without the eruptions. This is in May when he started working. These photos are taken in our OPD only. This is in August. Because I had to prepare this in such hurry in the morning only, I prepared the slides for this presentation today. So I couldn't add September month ka photos. He came even in September. Let us listen to the patient. The patient made a small video, very sweet of him. And but because the patient only knows Telugu, little bit of English, little bit of Hindi. So this was prepared in Telugu. So let us listen to the patient. I have managed. Look at the face of the patient, all clear. Isn't it wonderful? Isn't it the beauty of homeopathy? Can any other pathy achieve this? I don't think so. In a period of from Feb to the month of August, even though this video was not prepared in August, I think this video was prepared somewhere in June or July. Now he is having all hair grown because it was very fast, so I couldn't collect that. So I don't know whether time will permit to us about going further in this, but I thought
Madam, 12 minutes remaining. We can go ahead.
Okay, sir. I thought I'll discuss a little bit more homeopathic drugs about different types of grief and its causes. So I think I'll skip the grief psychological part as such, because that will take time. But thanks to this doctor, this psychiatrist, Swiss American psychiatrist, I don't know how many of you will recognize. This is Dr. Kubler-Ross, who gave the concept of who gave all the 5 stages of grief in her book on death and dying. All of us are aware of 5 stages of grief. All of us are practicing. Those who are students or those who are PG students, I prepared basically these slides for them. The 5 stages of grief are denial, then anger, bargaining, depression, and acceptance. I could have, and I can tell you all these things in detail, but time is very, very short, hardly 10-15 minutes are left. I don't want to miss the homeopathic part. So if you want, you can just read these on your own. Let us study homeopathy in grief. So the cause being grief, and if the cause is grief and it leads to psoriasis, then we studied in the case report, the only drug in your materia medica is Staphysagrea. Now, if the cause is grief and that leads to suicidal disposition, grief leading to suicidal disposition, the only single remedy in your materia medica is natrum sulph. So if a person comes to your clinic and he says that, when you come to know after investigating his life space that the patient is in grief, and he says that he's totally suicidal, single remedy given in your repertory is natrum sulph. If a patient is under grief and he develops physical complaints of asthma, then still single remedy in your materia medica is again natrum sulph. So if grief causes suicidal tendencies, the drug is natrum sulph. If grief causes asthma, the drug is natrum sulph. If grief causes cough, then we have a few drugs. These are the only drugs. I have written all the drugs. So I've made work easy for you. If a patient comes to you and in life space investigation, you come to know that this person is having chronic cough, which has no, pathological correlation, and grief is the only reason, all his reports are normal, then you can think of these bunch of these 6 drugs: Chamomilla, Arsenicum album, Asarum, Natrum mur, acid phosphorus. If there is grief and the patient develops anemia, only 2 drugs are there in your materia medica: natrum mur and acid phos. Shall I change the slide? To look at the time. So now you understood grief leading to asthma, the drug is natrum sulph. Grief leading to suicidal disposition, the drug is natrum sulph. Grief leading to anemia or causing anemia, drugs are natrum mur and acid phos. Grief causing cough, these are the 6 drugs on your slide, on your screen. Then grief causing convulsions, these are the drugs. These are the only drugs: arsenicum, hyoscyamus, opium, Artemisia vulgaris, ignatia, natrum mur, nux vomica. If grief causes diarrhea, then the drugs are colocynth, gelsemium, ignatia, calibrom, acid phos, calcarea phos, opium, sulph. See, these drugs I have compiled with the help of repertory, with the help of my PGs, but it is not that, grief causes, so how you have to differentiate from colocynth to gelsemium, gelsemium to ignatia, ignatia to calibrom, that is altogether a different, that will take so much of time. So what is the cause of grief in opium? What is the cause of grief in acid phos? Of course, acid phos also is a very, very important remedy for grief, where, there is ailments from death of loved ones or from ailments from disappointed love, where the patient goes into a state where he leaves the most important and passionate thing of his life. So there are various reasons, various causes of grief that you have to find out with a detailed case taking. I am shortlisting these rubrics so that for you, practicing helps become little easy, or you have that in mind that these rubrics exist in the repertory. So if you have a patient like that, at least you can think and look for such rubrics. Then if grief leads to anemia, weakness, then it is causticum, acid phos, ignatia, and picric acid. Acids we know are all having debility and weakness, but the 2 acids are acid phos and picric acid. If grief causes headaches, then we have set of these drugs. All drugs mainly for grief. Grief leading to sleeplessness, these are the drugs: natrum mur, gelsemium, ignatia, calibrom, sulfur, graphitis, lacasis. grief leading to amenorrhea, the single remedy is ignatia. These single remedy rubrics are more important and they give more weightage for us to reach to a simillimum. So if a patient comes with the absence of menses because of grief, in the phase of grief, single remedy is ignatia. If grief causes graying of hair, if the patient is in the phase of, grieving state and he starts graying of hair, premature graying of hair, single remedy is acid phos. If grief leads to hair fall, phosphoric acid, causticum, graphitis, ignatia, lechosis, lycopodium, natramine, and staph are the drugs. If grief leads to onset of menses, then there are only two drugs, ignatia and cocculus. One was suppression, that was the only drug was ignatia. If it starts, even though it is not the time of that cycle, the two drugs are ignatia and cocculus. If it leads to abortions, ignatia and natramine are the only two drugs. Grief causing abortion. Grief causing blindness, sudden loss of vision. Only single remedy in your Medica is Crotalus furulus. I know it is too much, but I'm grateful to IFPH that they are recording the videos and they send us the links. So through the link also you can remember these. You also have these in the repertories. You can go and check these. That was grief causing symptoms. Now symptoms leading the patient to grief. I mean, sir, is there some time left? 2-3 more slides are there, Dr. Shruti.
Yes, ma'am. We have 5 more minutes left. 6 more minutes.
Okay. This is a person being insulted. So if because of any kind of insult, then the patient goes into grief. This is just the opposite slide now from the previous. In the previous slides, grief was leading to symptoms, to the cause. Now, one symptom or one emotion or one incident leads the patient into the stage of grief, the cause of grief. Here, the only remedy where the insults lead to grief is opium. If there is, as you can see, thanks to Google Images, I could put some wonderful explanatory images from Google Images. This loss in money leading to grief, the drugs are only 4 drugs in your Meta-America. If there is massive loss in money, aurum metallicum, calcarea fluor, mesarium, sorinum. If a person, dwells about his past events, keeps on thinking about his past events, oh, kya hua tha mere saath, oh God, mere saath kya hua hai life mein, and then that leads to grief, he keeps on thinking about that, the only single remedy is platinum. If a person loses some objects, grief because of losing objects, again the single remedy is ignition. Here it is, I'm not talking about death of loved ones, losing of objects. So I specified in the image. Let me start the next slide. So any long past offenses happened with us in the past, and we keep on thinking about those past offenses, and then we are into a state of grief. Then there are these 4-5 drugs. One is calcarea, chamomilla, ignatia, opium, and staph. Punishments causing grief, grief after punishment, single remedy is ignition. So there are so many causes which lead to ignitia as a single remedy. If a person is worried about trifles, small things in life, and that because of those worries, छोटी-छोटी चीजों के बारे में सोच के अगर वो grief के state में he goes, then these are the only drugs: arsenicum album and beryl. If a person is, angry, then he goes into a state of grief, only remedy is ignition. So wherever I have marked this asterisk, that symbolizes that it is a single remedy rubric. So it becomes very, very important for us. If a person has disappointment in love, then the person is into grief. These are the set of a few drugs. As I told you, phosphoric acid, ignatia, natramur, auramur natronatum, natrum silicea, natrum silicata, and phosphorus. Auramur natronatum is another very wonderful remedy, where in the repertory, if you will go in the chapter of mind and you see ailments from death of parents, and then you will go into death of mother. Ailments from death of mother, single remedy in your materia medica is auramur natronatum. Ailments from any kind of deception, after being deceived by people, by known people, if the patient goes into grief, these are the set of the drugs. I won't read the drugs because it is time consuming. You can just have a look. If there is fright, if the patient is in the state of fright, then the patient is grieving about that. Single remedy again is ignatia. We have many drugs for ailments from fright, but fright causing or leading to grief, single drug is ignatia. You need to understand the importance. If the patient is delusional, because of those delusions, the patient is into grief, single remedy is zincum metallicum. I thank God my presentation is finished. I'm really very, very thankful for everybody for a patient session, listening to me, interacting with me, even though it was because of online session, we could not interact much. I'm really grateful to the director of my institution, Dr. Naveen Pavaskar sir, who keeps on pushing us for betterment and growth. I'm thankful to our principal, Dr. Nimai Chandra Dole sir, who is the backbone of our institution. I can never thank enough to the medical superintendent of Chim's Hospital, Dr. Pravaspal sir, and more so to my HOD, who is like a father figure to me and always being very, very supportive to me. And today's presentation, because it was made in a very short span, I cannot forget, last but never the least, my dearest PG scholars of my department. I would like to thank KLP Sushmita and Vijay Kumar, who kept a track on the patient, who kept a track on the photos. They were the ones to collect and take Vijay was the one to take the photos. Sushmita was the one who helped me compile the whole case report. Dr. Meghna and Dr. Sushmita, they helped me with the grief part of the session. And surprisingly, today morning only, my mother was like, why have you not put the video? I said, I have the video, but the video is in Telugu, so people might not understand. So she said, why don't you put subtitles? It is a technological world, AI world. I said, oh, she's right. So in the OPD, because it's raining here very badly, we had very few patients, and Dr. Harshvardhan from the Department of Practice of Medicine, CBDC batch, I just asked him that, will you be able to put subtitles? He said, yes, ma'am, I'll put the subtitles. So I'm really grateful to Dr. Harshvardhan, which, also helped me to put the video of the patient. So I'm really very, very thankful. Thank you, Dr. Shruti, for helping me reading out the chat boxes. Thank you, Dr. Dhanish. Very, very grateful to you. And I congratulate IFPH for completing 5 wonderful, successful years of promoting homeopathy. It's a wonderful platform. And not only the best part of IFPH is that homeopathy is being promoted in people who don't even practice homeopathy. So we are spreading the light of homeopathy to each and every house. Thank you, Dr. M.K. Sahani, sir. for consistently pushing everybody to give their best on this platform.
Thank you, Dr. BAINU SHARMA, and those who attend the session, and particular one special mention to Sudhi. She was really in prayer at the time, but anyway, she came here for
Sir, I'm
moderation.
open to any kind of interaction
Yes.
or questions, but time
Yes,
is
since our
we
time
can
is
discuss so many things about grief and so many
yes,
things.
we can have
It's
another
a
session
long
because our side time is already over. Another session is
time.
waiting. And once again, on behalf of IFPH, I am inviting all of you to watch and enjoy the 5th anniversary of our celebration and continuous uninterrupted webinar, which is a real uh, just like an Olympic medal as far as we people are concerned. So our Ayush Minister is to be inaugurating the session, and lot of dignitaries are coming here. Foreign dignitaries also participating, and we have made all arrangement for the same. And there will be special sessions for a discussion on cancer, the presentation of cancer, then agro homeopathy, dental homeopathy, veterinary homeopathy, and there is some time dedicated to the students to interact with the foreign faculties, and there will be a discussion with some eminent, prominent editors to motivate them and to promote homeopathy rather than simply sitting here and discussing something. So these are the things arranged for the day. Hope all of you will join us. Thank you, Dr. BAINU SHARMA, once again for
Thank
coming
you,
out
sir.
here.
Thank you.
Thank
Thank you,
you
sir.
all.